Did you know that in some aged care settings, older Australians can be physically restrained, chemically sedated, or prevented from accessing certain spaces, all in the name of safety? For many families, this comes as a shock. Restrictive practices are one of the most sensitive and tightly regulated areas in Australia's aged care system. They directly affect dignity, freedom, and human rights. So when are they allowed? When are they not? And how can families make sure their loved ones are protected? Today, we're breaking it down clearly and simply. Hi, I'm Elsa. With over 25 years of experience as an aged care consultant in Australia, I'll be sharing practical advice to help you navigate these changes. Let's get started. Restrictive practices refer to any action or intervention that limits a person's freedom of movement, rights, or decision-making ability. Importantly, they are not treatments. They must never be used for convenience, discipline, or staffing shortages. Under Australian aged care standards, restrictive practices must always be a last resort, proportionate to the risk, used for the shortest possible time, and applied in the least restrictive way possible. There are three main types of restrictive practices in aged care. Physical restraints, such as bed rails, belts, or physically holding someone to prevent movement. Even when intended to prevent falls, they can increase injury risk and emotional distress. Chemical restraint. This involves medications, like sedatives or antipsychotics, used to influence behaviour rather than treat a diagnosed condition. These medications can increase fall risk, reduce alertness, and cause serious side effects in older adults. Environmental restrictions. For example, locked doors or limiting access to outdoor areas. While sometimes introduced for safety, they can significantly reduce independence and well-being. Restrictive practices directly affect human rights, including dignity, freedom, and personal autonomy. Research and lived experience show that inappropriate use can lead to increased anxiety and agitation, depression, loss of physical function, emotional trauma, and breakdown of trust between families and providers. Because of this, Australia has introduced strict oversight, documentation, consent requirements, and regular reviews to ensure these practices are minimised and justified. Restrictive practices may only be considered when there is a serious and immediate risk of harm. All less restrictive alternatives have been tried. The measure is necessary to prevent harm, not manage inconvenience. Before implementation, providers must assess the person's health, well-being, and the potential impact of the restriction. Informed consent, documentation, and regular review are legally required. The core principle in aged care is simple. Safety should never come at the unnecessary expense of dignity. Often, behaviours like wandering are signals of anxiety, boredom, or unmet needs. Person-centred care focuses on understanding those needs, adjusting routines, modifying environments, and providing familiar support, rather than imposing control. Families play a vital role. You have the right to ask why a restrictive practice is being proposed, request alternative strategies, review documentation, and ensure regular reassessment. Transparent communication is essential. Choosing the right provider early can significantly reduce the risk of inappropriate restrictions later. Navigating aged care decisions can feel overwhelming, especially during times of rapid health change. SSCA offers a free, independent care finding service to help families compare providers, understand care approaches, and make informed decisions. With over 25 years of experience in Australia's aged care system, SSCA helps families in Melbourne find services that respect both safety and dignity. Because protecting your loved one's well-being should never mean compromising their rights. If you found this video helpful, give it a like and share it with others. Subscribe to our channel for more insights into aged care in Australia.